We are still discussing about the importance of counseling, asking ourselves why counseling. In our last episode, we were talking about the importance of counseling and why people should consider counseling and what is counseling. And we left that question to you so that maybe you can brainstorm on the importance and why people should seek counseling services. Now today I want to do a different topic, but I would like to highlight some of the instances or situations which I think in the medical field do require a counselor, a help of a psychologist, so that at least you can understand why it is important for counselors and psychologists to come out in this field and play their work or play their role. Or it would be easier for the people who are seeking counseling help to understand that in that circumstance they have a right and they have an obligation to seek for counseling services. Now, there are chronic medical illnesses or chronic conditions. I would like to put them as medical conditions because most of the times they end up in hospitals, and in most of the situations they present with the urgency for admissions. Like for example, we have a condition like diabetes. Diabetes ni ugonjwa wa sukari. Let me use the simple layman's language. It's a condition whereby you require maybe to use anti-diabetic medications or maybe insulin for the rest of your life. Imagine that today you are okay. You didn't have this kind of a diagnosis, and then you go to hospital, and then the doctor screens you because of the way you presented in the maybe outpatient clinic or in the emergency department, and then they make a diagnosis for you. Maybe you present in a DKS situation, or maybe you present in a hypoglycemic situation. And now your doctor makes a diagnosis. It tells you that today onwards, you have to understand that you have a condition called diabetes. And you have to be taking your medications, or else you have to be injecting yourself insulin. Remember, this is something you had no idea about. Alright? You are just having symptoms, and then you came, or you are brought to hospital. Now this is a new diagnosis that you have. Alright? So, me as a clinician, I have to play my role, help you in whatever way I will help you. But then at the end of the day, I expect you to start taking your medications and also to check on your diet. But then I leave it at that. And then I will give you a clinic. I will tell you the next time you are coming for a clinic, you have to see your nutritionist, and then you have to see me, so that I can tell how you are responding to the medications that I prescribed to you. Now, there's these general assumptions of clinicians and medical practitioners that it is obvious that these people will go and take their medications. I feel having an understanding of what counseling is, some of these conditions, which are chronic medical conditions, whereby someone is going to use their medications for the rest of their lives, they need counseling. Before even your patient starts taking medications, or after they have started taking their medications, it's important that these people understand their condition, they understand the importance of taking the medications and adhering to those medications, and their behavioral changes maybe on their lifestyle and the feeding habits, so that maybe now they will understand this new condition will not kill me if I adhere to medication. The other condition which I found funny and quite impressive, I would say it caught my eye, was chronic kidney disease, or what we call CKD. Most of the times watu wa tukitumia lugha ya Kiswahili ni shida ya figo, whereby now the kidneys are affected and their roles are interfered with. When your kidney is affected, the role that the kidney plays tends to be tempered with them. So now in a condition whereby someone has a chronic kidney disease, whereby now the filtration rate and whatever the kidneys are filtering has been interfered with, you'll find that this person maybe will now require what we call hemodialysis. And for you to accept the process and the medical procedure for hemodialysis, it's not an easy thing. I met a 17 years old girl in one of the wards, and she was diagnosed with CKD, the chronic kidney disease. And then their parents, we had to explain to the parents that now this girl at 17 years old will require a dialysis catheter, because the condition that the girl has will be requiring regular hemodialysis. And then there are medications also, and a lot of other things that this girl has to adhere to. So now this is a young girl. She's still in a teenage age, because 17 years old, And now we really have to play a big role talking to the girl and talking to the parent. Because now this condition, at such a young age, a chronic kidney disease will require hemodialysis. So this girl requires a dialysis catheter. So it was so challenging that they had to talk to the girl several times before she accepts her condition and before the parents are in terms with such kind of a diagnosis. Now, these conditions can affect anyone. The importance of it is that you have to understand that these conditions are new, and any newly diagnosed condition, especially the chronic diseases, they require counseling. Another condition, which I've met several in the wards, is stroke, or what you call a cerebrovascular accident. They occur to anyone, maybe they can occur to anyone. Majorly patients with hypertension at their old age or late ages, maybe 60s and they're above, who are maybe not adhering to medications. And the funny thing with stroke is that the presenting complaints, or the way the patient presents to the facility, if you are not conversant with the condition, you might be able to fear the patient. Maybe the caregivers. Imagine you had someone who was okay yesterday, and then all of a sudden a mouth has shifted to the other side, maybe to the left or the right, and then they have lost maybe strength of either the upper or the lower limbs. And then there's someone you are used to spending time with them, then all of a sudden their mouth has shifted and you don't understand what this thing is. Maybe you've never met such kind of a condition. Then you are there, this patient maybe requires a feeding tube, because maybe they cannot feed, and maybe their GCS has lowered to less than 7. They cannot talk to you. Yesterday they were talking to you, now today they cannot talk to you. And this is a condition that now you have to accept, that this person may not recover adequately or fully before you are discharged to go home. And now you have to accept that now this is a new condition, maybe to someone that is so dear to me, my mom or my father, and this is how I have to live with them. for this duration of time. You see, we as clinicians and doctors, we play our part. We prescribe those medications. We do the imaging test, whatever thing we have to do to make a diagnosis for you. And then we have to start the medications for you. And we expect you guys to adapt very fast, accept, and go home and come for clinics. But there's a gap. And that is what I've been talking about all the time. There's a gap that everybody needs to understand. You, the caregiver, you, the patient, and even the clinicians ourselves, that this gap has to be utilized, and our people have to get the real care. We don't have to force the acceptance of the diagnosis. Yes, we are giving them time to accept, but counseling is needed because this is a new condition that was not there yesterday and it is there today. Now, there are so many other conditions which are medical. There's this condition, the HIV and AIDS. This has been talked about because of the stigma most of the times, because of acceptance. And this is what I've been talking about. The stigmatization that is there in HIV and AIDS because there's no psychoeducation on counseling. There's no psychoeducation about the stigma and how to escape that stigma. And people are in denial. The moment someone has been diagnosed with HIV and AIDS, it becomes a crisis to them because they don't know who to run to, who to talk to. They cannot disclose this to their friends, yet they need someone to talk to. And so many other conditions. In fact, most of the medical conditions we require counseling and psychological support. Now, before I get to other behavioral conditions, I would love to talk about a condition which is highly avoided. A condition which has become common to the younger people too. A condition like erectile dysfunction. Erectile dysfunction has been overlooked, and it is affecting, and these sexual dysfunctions, it is affecting even the younger people. And most of the times it's psychological because of the stressors behind the condition. And the young people end up acquiring what we call short-term solutions to this erectile dysfunction, hoping that this will solve their problems, which doesn't. Most of the infertility, erectile dysfunction, sexual dysfunctions, pregnancy losses and complications related to pregnancy, especially to younger women, will require counseling support. I will therefore urge you, if you have a condition, maybe the one that have been mentioned there, or any other condition that maybe you don't understand, or you've been diagnosed to a new condition and you are now taking medications, maybe because of the pressures behind non-adherence, it is advisable to seek the help of a counselor. This can be through private practice. You can go to them on private. You can search for any counselor or a psychologist elsewhere to help you understand your condition. There are medical counselors, there are clinical counselors, and you can also use the basic counseling. They understand these conditions. At least you need to talk to someone to elaborate for you the importance of, one, you understand the condition, and then you understand the reason why you are taking these medications. From that point of view, it will be easier for you to even accept and not feel like these medications are becoming a burden to your life.